Hello, I'm Senator Mike Reichenbach, Chairman of the Joint Committee on Children. Thanks for giving me a few minutes to share an update on what's been happening in South Carolina around mental health. There's been a lot of meaningful work underway, and I'm glad to highlight some of the progress we've made. One of the biggest changes recently has been the creation of the new Department of Behavioral Health and Developmental Disabilities, or BHDD. This came out of Senate Bill 2, which merged several agencies that handle mental health, developmental disabilities, and substance abuse services. The idea is simple. When someone needs help, they shouldn't have to figure out which door to knock. There should be no wrong door in South Carolina. This major restructuring is designed to improve communication, reduce silos, and make sure people get the support they need more quickly and more effectively. Last year, we also passed House Bill 3752, which allows South Carolina to join the Social Work Interstate Licensure Compact. That means social workers licensed in other compact states can practice here. It's a practical step that helps us strengthen the behavioral health workforce our communities rely on. We've also seen several bills introduced this session to support youth mental health. For example, Senate Bill 30 and House Bill 3630 would expand suicide prevention training to include elementary and middle school staff, as well as employees in higher education. High school staff already get this training, so this simply extends that safety net. Senate Bill 31 and House Bill 3631 would make sure that 988 Suicide and Crisis Lifeline appears on ID cards for younger grade levels and private schools too. And if a school doesn't issue ID cards, they'd still provide the information somewhere visible, like on their website. These proposals have support from the Joint Committee on Children and the South Carolina Suicide Prevention Coalition. Now, two Senate bills that I think are especially meaningful passed our chamber but haven't yet moved in the House. Senate Bill 862 addresses situations where an adult in a behavioral health crisis temporarily can't make informed decisions. It was inspired by a heartbreaking case involving suicide, and the goal is simply to give families and providers better tools in those moments. Senate Bill 935 focused on posting seizure first aid information in state workplaces. Now, even though it hasn't advanced, the good news is that the Department of Public Health already has electronic resources available at no cost. And looking ahead, there are some new proposals worth watching. These include a bill to add mental health public service announcements on social media platforms used by young people, another bill updating emergency admission procedures for mental health crises, and one aimed at improving perinatal mental health screening and education for parents. Finally, the upcoming budget continues to prioritize mental health, including crisis response, 988 support, inpatient care, and workforce development, all through the lens of the new BHDD. South Carolina is committed to strengthening mental health services across the board. And I'm grateful for the opportunity to work alongside so many dedicated partners to make sure every South Carolinian has access to the support they need. Thank you.